it's me, Jen Roberts. Today we're going to cover Section I of the MDS. We're going to be discussing active diagnosis versus inactive diagnosis. So if you're struggling to determine which diagnosis to code for your resident on the MDS, you've come to the right place. So let's get started. To code a diagnosis as active, you must meet two requirements. The first requirement is that you have a physician's signature within the last 60 days prior to the ARD that shows that the physician has noted this diagnosis as active. The diagnosis should have a direct relationship to the resident's current functional status, cognitive status, mood or behaviors, mental treatment, nursing monitoring, or risk for death in the 7-day look-back period. The second requirement is that you must have an active treatment to support the diagnosis was active during your 7-day ARD look-back time frame. An active treatment could include medications or treatment that was given for that diagnosis. You should also have a care plan in place for those diagnoses that you're coding active on Section I of the MDS. When you code an active diagnosis in Section I, you are stating that there is a potential for that diagnosis to impact your resident's well-being. After you have the physician's signature signed 60 days prior to the ARD, then you can begin to look for an active treatment. An active treatment can include the care plan. When we create a care plan, we include interventions that we're monitoring for all of the time. So that means that the diagnosis is active. So if you have the physician's signature within 60 days and you have an active care plan that you're currently following, then that diagnosis is also active. Now we're going to take a look at an example. Our ARD is 3/17, which is the last day of our assessment. Our resident has CHF, but we still have to find the MD's signature. The MDS has different dates for data collection. For the MD's signature, it's a 60-day look-back period. 60 days from the date of your ARD, which is 3/17. That puts us at 1/17/2019. So we must find a signature between 1/17 and 3/17 where the doctor has signed off CHF. Now we will review the medical record to see if we can find the physician's signature within our 60-day time frame. We can also use a nurse practitioner's signature. We'll review the entire medical record, including the hospital records, as long as it's in our time frame. We can also use prescriptions that have been signed by the physician. As long as they have the diagnosis listed, we can use that to support the active diagnosis signed by a physician. So in this example, we're going to use this prescription to satisfy our first requirement of coding a diagnosis on the MDS. Now that we have the physician's signature within the 60-day time frame showing that CHF is active, we'll begin to search for the medication, nurse's note, or care plan that might be in place to show that CHF was active during our time frame. The look-back period for this is 7 days, so we'll be looking from 3/11 to 3/17 to see if we can find a medication or a nurse's note or a plan of care that indicates we were actively treating this diagnosis during that 7-day time frame. We begin by reviewing the electronic medical record, and we can see that the resident received Lasix 20 milligrams daily for CHF. We would only need 1 day to support that the diagnosis of CHF is active. So now we've met the two requirements to code CHF on the MDS in Section I. Let's take a look at our other two examples that would make the diagnosis active as well. The nurse's note above shows that the resident had complaints of shortness of breath while lying flat and required the head of bed to be elevated due to the diagnosis of CHF. That note supports CHF as being active during the 7-day time frame. We can also see that the care plan has a clear goal target date of 3/20/2019 and states that the resident is at risk for ineffective tissue perfusion related to CHF. We provided a no added salt diet, a fluid restriction, and daily weights. The care plan also supports that the diagnosis of CHF is active. So to meet the requirements to code a diagnosis in Section I, you have to make sure the diagnosis is active during the time frame, which could include one of the following: a nurse's note, a care plan that is active during your time frame, or a medication that was given for the diagnosis that you're trying to code in Section I. We've discussed the MD signature look-back period and the active treatment look-back period, and now we need to discuss the look-back period for the diagnosis of urinary tract infection. Urinary tract infection is the only diagnosis that has a 30-day look-back time frame. In that 30 days, you'll be looking for the diagnosis signed by a physician, NP, PA, or a clinical nurse specialist if allowed in your state. It also has to be determined that the resident had a UTI using evidence-based criteria. In conclusion, when coding Section I of the MDS, it's important to keep the look-back time frame in mind. 60 days for that active MD signature, 7-day look-back period for an active treatment, medication, care plan, nurse's note, whatever makes that diagnosis active in the 7-day look-back, and a 30-day look-back time frame for a UTI. To get a copy of the free look-back calculator seen in today's video, click the subscribe button. And if you enjoyed today's video, make sure you share it with a friend. And as always, I hope you have an amazing day, and thanks for learning with Jen.